Acne scars are a problem which is very common today. People who suffer from acne scars not only are bothered by the appearance of their skin, but there's profound psychological effects as well because their self-confidence is affected. There are a lot of treatments that are advertised for acne scars, but because acne scars are fairly complicated and there are a lot of different types of scars, there's no single treatment which is best. Some acne scars look like someone has actually taken an ice pick and poked the skin. You see a little indentation. There's no laser, there's no chemical, there's no drug that's going to make that scar better. What's noticeable is the way the light reflects in those scars because it looks as if there's a little hole. In order to treat an ice pick acne scar, we actually remove the scar with a minor surgical procedure performed in the office and put a couple of stitches in to make the skin flat. Now you might say, well, why would I trade one scar for another? The key to success in treating acne scars is to reduce the amount of irregularity in the skin surface. So if you can take a deep scar or a depressed scar and make it more flat, it's going to look better. The other major types of acne scars also involve contour changes in the skin, but rather than being deep pits, they're sort of gentle rolling changes. In order to treat these changes, I like to start with a minor surgical procedure, again performed in the office under local anesthesia, easy to recover from. It's called subcision. The goal of that procedure is to make those depressed areas less deep and less depressed. And what we do is we use a little instrument to create a pocket under the scars at their most depressed point so that they can rise up and be less depressed and more even. The subcision procedure can be performed at the same time as ice pick scars are removed. Most people have more than one type of acne scar, so we'll start off usually with a procedure done in the office, treating the depressed and the ice pick scars, and then a few weeks later, we'll often move to some type of laser resurfacing or technology-based treatment, which will approach the scars from a little different manner. Acne scar treatments are a marathon as opposed to a sprint. There's no single treatment which is going to give you as much improvement as you're ever going to get. And it's often a series of treatments that we continue to do until someone feels comfortable with their appearance. Someone who goes into acne scar treatment thinking that they're going to have one treatment and their skin's going to look like they never had acne before should not bother doing treatment at all. Our goal is for improvement. A young woman came in to see me, about 22 years old, naturally blonde hair, but her hair was dyed bright pink and she was wearing a very low-cut dress. She was basically saying, hey, look at anything but my face. Her acne scarring, objectively, really wasn't all that bad, but it was terribly important to her. We did the subcisions that we talked about and excised a couple of ice pick scars and followed that up with laser resurfacing. When she came back to see me for her final visit, about a month after her resurfacing treatment, I didn't even recognize her. Her hair was back to its natural color. There was no more pink. She was wearing a business suit. She made eye contact, and her self-confidence had been restored. The treatment of acne scars can be very, very rewarding. It changes people's lives, but it's important to have appropriate expectations going into these treatments.